몸이 아프지 않는 게 얼마나 큰 자산일까요? 하지만 사람의 몸은 시간이 지날수록 여기저기 고장나고 아프기 마련인데요. 개인적으로는 건강을 유지할 수 있는 방법에 대해 고민도 하고 보험에 관심들도 많이 있죠. 국가적 차원에서는 국민들의 의료 지원을 위한 다양한 정책들을 적용하곤 하는데요. 전 세계 안에서 병원비가 무료여서 유명했던 영국이 최근 들어 의료 붕괴 소식을 전해 이슈가 되고 있습니다. 병원비가 무료인데 결국 4명 중 1명은 의사를 못 만나서 약국에서 약을 대충 사 먹으며 버티고 있다고 하는데요. 의료진들을 만나는 일은 하늘의 별을 따는 일보다 어려워서 비전문가에게 의존하는 경우가 허다하다고 합니다. 무료인 게 중요하지 않다. 지금은 영국의 의료 시스템을 한국처럼 바꾸어야 할 때다. 라는 입장으로 다큐멘터리까지 제작하여 방영했다고 합니다. 영국의 현 시점은 어떤 상황인지, 왜 한국을 벤치마킹해야 한다고 한 것인지 오늘 영상을 통해 살펴보도록 하겠습니다.
One in 4 meet doctor's nail and take medicine, while Manda 16% rely on self-medication or non-specialist. Britain, which eventually made it difficult to book neighbourhood hospitals. The title of an exemplar of the world has been shattered. Our UK healthcare system, illuminated by the World Health System by the system of medical care and personal care to the whole nation, is eventually collapsing. Most people are self-medicating because of the difficulty of booking care for an alternate neighbourhood member of the primary care, and there is a surge in patients who are on private healthcare and are looking for private medical institutions. Commissioned by the Liberal Democrats, pollster Sabanta Comrays surveyed 2,061 British adults for medical conditions, according to a study by the party. 1 person in 4 said they couldn't book neighbourhood members and found they were buying drugs online and so on. 19% of respondents said they had the experience of finding an emergency room because they could not go to a neighbourhood counsellor, and 16% said they had medical treatment on their own or asked non-medical professionals to do it if they didn't book neighbourhood counsellors. Unless it is an emergency, the patient must make the visit first by household of the members of the designated public neighbourhood, and the family doctor will give the patient a prescription for the drug and, if they need further treatment, issue the patient a higher hospital referral. Part of the drug value is borne by the patient, but the care of the family doctor is free. It is called National Health Service, introduced in 1948, and this service is kept as a tax instead of being paid directly to patients. As public health services became poor, private health insurance was purchased, or separately paid for medical care. Those treated in private hospitals were also found to be 11% of the total. Earlier last month, the Office for National Statistics also published a survey showing that 5% of people had private health insurance, while 7% used private hospitals. The president of the Ed Davey LDP said that the people do not use neighbourhood counsellors as national figures. Some stations have pinched over the near impossible face-to-face care in homes. We deplored the doctor now that it was difficult to see him, and he said he was in a shocking situation where patients were judging themselves and buying drugs. Davey claims the Conservative government has in the meantime neglected the National Health Service and failed to keep its pseudo-facilitator commitments, ruining the health system. The LDP called for people to have a plan for family doctor care in at least a week. In fact, for this situation, the Vice President of the Family Council of the British Medical Association, Dr. Richard Banmelatz, said, "It doesn't stop doctors from declining, and it's impossible to make these demands of the LDP happen." In the aftermath of the United Kingdom's formal departure from the European Union at the end of January 2020, doctors of European Union member states left the country. As of November last year, the workforce of full-time households was down 1,973, about 6%, from September 2015, it said. But as of September 2022, the number of families is 2,300, more than 3 years ago, the Health Ministry's spokesperson said. For 3 years, the medical staff in charge of the neighbourhood hospital also claims to have filled in at 20,100. And yet, 1 in 4 people in the UK right now is in a situation where it's impossible to treat, and it's a very puzzling situation. Not only that, but when we looked at National Health Service data last November, it was found that 1 in 3 emergency patients waited more than half an hour for ambulances to arrive. 1 in 3 people had to wait longer than 4 hours when they arrived at the emergency department, and 40% of patients needing hospitalization were left waiting for treatment at their beds for more than 4 hours. This ultimately leaves 300 approximately 500 patients dead each week due to first aid delays, which has left them without shock. From 1,200 to 2,000 patients dying due to delayed first aid, at least in a month. In a year, about 40,000 to 24,000 people will die from simple first aid delays. At this point, we in Britain need to objectively acknowledge that something is wrong. Don't neglect the dying people. Look at how other countries' health systems are run. Benchmarking will need to quickly complement the UK's healthcare system. You can experience the miracle of saving the dying people even if you move a little forward in the time of complementing. Of many countries, the national health insurance in Korea is considered the most ideal health system for the country. In this documentary, we will introduce you to the medical system in Korea. Korea's national health insurance is one of the social security systems and belongs to the public health insurance system. It is still said to be one of the world's most popular social security systems, as a system that benefits the people greatly. The effect of Korea's national health insurance is that it does not need to be put on any words. If you are Korean, the majority of them are medical systems that you know all too well. It's an achievement that's been done by the sweat of the nation, the citizens and the medical people alike. When an individual became ill and ended up visiting the hospital, most of the medical payments went to the country, the state. That is, you will pay from the National Health Insurance Agency and you will only bear some out-of-pocket expenses. Total medical costs are also about 70% of the OECD average. In fact, based on the fact that it is as high a medical level as South Korea for 70% of the average, you can see that it is not expensive. In Korea, national health insurance is said to be a solution for a single piece of Korean money, from hospital to pharmacy, in case of simple illness. It's easy to say, there's no 2 cups of coffee. It is said that making it easy for people to visit hospitals, so that they can act by spotting the disease early on, which in fact can significantly lower the chances of worsening the disease. That's how South Korea quickly increased its average life expectancy, and in 2003 it passed to the United States. In South Korea, AFA does not have any money and does not die while being untreated, according to national health statistics in 2013. Of those at least 19 years old, 1.5% of men and 4.1% of women did not go to the hospital for economic reasons. More than 90% of South Koreans said they were unable to get to the hospital because they didn't have time. We in the UK, 1 in 4 people have time and they don't have free hospital bills, they don't have care. In Canada, the wait time for care is long enough to say that someone has waited nearly 15 months for abdominal pain. Not only that, but in the case of the United States, without money, the cost of medical care itself is very high. The United States, called developed countries, is actually at the bottom of developed countries with a median life expectancy. If you listen to the stories of Americans, British people, living in real Korea, one of the best things about Korea is cheap medical bills, but a high level of medical technology, I say. If you die, including your plane's price to the end of medical shopping, getting treatment in Korea without health insurance is cheaper than getting treatment in the United States. In fact, there is a growing trend of people from overseas visiting Korea for treatment. Hong Kong has a similar healthcare system to our UK. Healthcare in Hong Kong is on its own expensive side, as well as setting up a private hospital where medical expenses are not supported, etc. It looks like it has a strange way of operating, taking apart the wealthy. After all, the rich people in China go to Korea and get treatment, and now it's too easy to see. Under the title of Korean nationals, South Korea is pursuing national health insurance for all nationals under the title, "We provide high-quality medical services." Because of this, the people keep their health from various diseases by the lower hospital thresholds, and you can protect your health from all kinds of viruses. First aid is also well equipped to compare to our UK. In this regard, it seems as though our UK should also take a good look at the medical systems in Korea and bring one element to apply. It's also good to be free, but dying because you don't get the healthcare itself, just being a non-professional or buying your own medication, is something that obviously needs to be reduced.
해외 각국의 반응 살펴보도록 하겠습니다.
몇 년 전에 아버지가 크게 아프셨는데 미국에서의 병원비가 너무 비쌌고 어떻게 할까 발을 동동 굴렀던 적이 있다. 그때 한국인 지인을 통해 한국 병원을 알게 되었고 바로 비행기 티켓을 준비해 한국에 들어가 치료를 받았지. 그때 한국인 친구와 한국 병원이 아니었다면 비싼 병원비로 미국에서는 치료를 엄두도 못 내고 그렇게 아버지를 떠나보내야 했을 수도 있다. 한국의 의료 시스템과 높은 시스템 대비 합리적인 가격은 정말 전 세계적으로 알아줘야 한다.
무료 의료 시스템 이거 진짜 별로다. 영국 사람들은 사실 이제 반포기 상태 모두가 병원에 가는 걸 웬만해서는 포기한다. 무엇을 위해 무료로 만들었는지 이해가 잘 안 될 뿐 한국의 건강보험은 정말 최고다. 우리 영국도 한국의 건강보험 의료 시스템을 적극적으로 수용하여 정부적 차원에서 어서 진행시켰으면 좋겠다.
쉽게 말해 유럽은 아프면 무료 치료, 그러나 오래 기다려야 함. 미국은 아프면 바로 치료, 그런데 엄청 비쌈. 한국은 아프면 곧바로 치료, 병원비 별로 안 비쌈이듯. 무엇을 선택하겠는가? 이건 어느 나 사람이든 개인의 경제적 수준이든 어떤 기준에 비추어도 선택은 동일하지 않을까 싶다. 한국 만세.
세상을 보는 눈, 오늘도 한국이 한국스러웠네요. 구독과 좋아요는 저희 채널에 큰 힘이 됩니다.